If you haven't seen it yet, hot off the presses, the Surgeon General has released an advisory calling health worker burnout a national crisis. So I want to take a moment and just help everyone understand what it means when a Surgeon General does this. Is that okay?
Yeah, and actually, I will post this article on your webpage and in the links in social media so everybody has access to it.
Okay, great.
Okay.
So the Surgeon General is the nation's premier doctor, and I think many of us have gotten to know Dr. Vivek Murthy so much more because of this pandemic and the big role he's played with trying to address COVID in our country. When the Surgeon General releases an advisory, it really catalyzes change, not for months, but for years. And an advisory is one type of written document that comes from the office. But to give you an example, in a slightly different vein, back in the day when we thought smoking was okay, and then we realized it wasn't, a lot of the work and the policies in place now are the results of the Surgeon General calling for tobacco control and educating the public, and then leading to all of the changes that we now see with no smoking in bars and on planes, and protecting our children from e-cigarettes that really got kicked off by the work of the Surgeon General many, many years ago. So when we release a document like this, when the office releases a document, and this one is, it's pretty extensive because it is actually laying the blueprint for the country on what is causing burnout among healthcare workers, why we need to care. And the reason why we have to care is when we get sick, we want to make sure that our nurse, our tech, our doctor, they are working at the top of their game with all the tools they need to help us. And burnout is the obstacle to that. And then it lays out a blueprint of what all the major stakeholders need to do, from the tech industry to federal and state government, to health systems, to us as individual practitioners, and to the public. So I really encourage you to look at it.